Today, I'm here to provide a brief overview of the research LADOT conducted in the early phases of the COVID-19 emergency, and specifically how we use the StreetLight platform in addition to other data sources to expand our available data sets from a citywide perspective and describe our next steps in continuing this work that will shape policy outcomes and investment decisions. So starting in March 2020, LADOT, like many other agencies, acted quickly to deliver immediate relief in response to the COVID-19 global pandemic. This relief included adjusting traffic signal timing citywide to prevent speeding, eliminating the need of touch push buttons for pedestrian crossings at our busiest intersections, relaxing the enforcement of parking regulations on streets where residents no longer drive their car to get to work, working with community groups to implement slow streets for physical activity and limited local car travel, unlocking curbside road space by setting up temporary pickup zones and outdoor dining areas, and so on. But as LADOT acted quickly to respond on all fronts, it was also apparent that travel trends had shifted. But the travel trends themselves and the underlying causes were not well understood. So at the surface level, we were seeing very little rush hour traffic, many more people walking locally in our neighborhoods, but we wanted to dive deeper and understand the trends, as well as shape the response and we launched an applied research effort to monitor the usage of different mobility options and articulate the travelers' lived experiences with using mobility offerings. This effort advances LADOT's vision that all people should have access to safe and affordable transportation choices that treat everyone with dignity and support vibrant, inclusive communities. And this is exactly why a core question emerged. Would the public health crisis further exacerbate inequities by disproportionately burdening people who are already experiencing barriers to mobility and physical connectivity before COVID-19? To dive deeper into the data and test how and where people changed their travel due to the COVID-19 pandemic, LADOT staff used the hundreds of thousands of transportation data points available on the StreetLight platform, as well as other data sources available to us to evaluate local travel trends. We classified this as prior to COVID, so looking at January, February, and then during the initial phases of the COVID-19 emergency, so late March and through April. To help frame the insights that you will hear about, I want to put Los Angeles' early local response into context. Specifically, back in March, which does seem like a lifetime ago, the city and county of Los Angeles declared a state of local emergency. Major employers like Google, Amazon, Facebook, and other companies encouraged their workers to work from home. LAUSD schools and many businesses were deemed non-essential and ordered to close. The following week, Mayor Garcetti's Safer at Home order went into effect. So of course the timeline here is it pauses at May, but we do know from our experiences that COVID-19 is still with us. It's still affecting Angelenos and our nation today. And we know that there have been many who've been infected and worse, unfortunately. So these initial findings helped LADOT to understand how the virus was affecting Los Angeles, and specifically at the neighborhood level, what distinctions there were and how the coronavirus pandemic was affecting travel. So the research is ongoing. It doesn't end in May. It's ongoing currently, and the insights that we have gathered that I'll present today and that we are continuing to gather will help to shape policy in response to a growing crisis. So with that, I want to jump in and show you a few of the early findings. Next slide, please. So to start, we looked at the trip reduction index calculated by the Boston Consulting Group using StreetLight data for all available counties in the United States. So during the initial phases of our nation's experience with the COVID pandemic, LA County strongly adhered to the Safer at Home order compared to other counties nationally. As the local agency responsible for managing mobility services and street operations, LADOT wanted to dig deeper to generate more locally significant insights, and we use the StreetLight InSight platform for this. So on the next slide, LADOT already generates huge amounts of vehicle volume data from our network. We have in-road loop detectors installed to inform the programming of our automated centralized traffic signal system, which is called ATSAP. And LADOT, the research team working on this effort, accessed detectors at 12 of those intersections to calculate a citywide driving activity trend line that was then compared to the StreetLight platform's location-based data analytics. LADOT data showed that compared to data from March 10th, so just before the Safer at Home order, the sample locations experienced a 30% drop in the number of cars after LAUSD public schools closed. And then compared again to March 10, a 47% drop after the stay-at-home order went into effect. And also significantly, an upward climbing vehicle volume trend. So you can see that the line does trend up, and it has continued to do so. So with a high-level understanding of vehicle volume changes from observed verifiable count data, we queried the StreetLight data platform to better understand car activity metrics beyond those sample locations and throughout the city. Next slide, please. So the StreetLight platform provides LADOT with aggregated, privacy-safe, historical data on vehicle activity for the entire city. So with the broad understanding of percentage changes gleaned from our own loop detector system, we ran several analyses to get citywide vehicle metrics. Similar to our vehicle count data from 12 intersections, StreetLight platform showed a 30% reduction in citywide volumes. And when I say citywide volumes, I mean the estimated vehicle trips. And that was for the day of the day LAUSD schools closed compared to March 10th. And then again, 21% below the average for a typical Monday in January 2020. So we noticed that the number of estimated vehicle trips citywide dropped somewhere between 30 to 50% below the January 2020 levels. But we have been seeing increases in vehicle travel, indicating that people are moving around more and choosing to perhaps drive a car in place of other modes. So that's a question, but it does show us that driving has been trending upwards. So another key insight from this longitudinal visualization is that the spike in vehicle trip making that starts on Sunday, March 1st through Friday, March 13th, so right before the declaration of the local state of emergency, Angelenos started making significantly more vehicle trips than the previous week and earlier in the year. So this leads us to believe that people in Los Angeles with access to a car started generating more vehicle trips than usual around the time that the national and global news amplified its coverage of the COVID-19 global pandemic. And perhaps this may have been to access grocery stores, other services. There were a number of very long trips as well, so perhaps to leave town. So it is interesting that there was an initial spike. And while daily weekday citywide VMT also decreased 30 to 50% below January 2020 levels, VMT began to trend upward again. VMT is important here as a metric because we have been talking about volumes of trips, but when we're talking about VMT, we're not only capturing the number of trips, but also the distance or how far those trips are going. Next slide, please. And a critical part of the research was looking citywide. So if we're looking at evaluating how vehicle volumes and VMT trends changed in different neighborhoods, as opposed to the averages citywide. A main takeaway was that trends were not consistent throughout the city of Los Angeles. So while on average we saw certain trends, people in communities of color experienced the smallest reductions in generated VMT, while people in wider, wealthier communities were able to reduce their VMT. Perhaps, again, these are theories, but perhaps being able to work from home in larger proportions and having more disposable income to make fewer trips to grocery stores to procure other either groceries or other goods and services. And as you can see in the slide, if you're familiar with Los Angeles, you might recognize these neighborhoods, the top 10 and the bottom 10, and it it does trend in terms of matching the key takeaway here, which is that the communities of color have experienced the smaller reductions when it comes to VMT. On the next slide, people living in neighborhoods with high poverty we found that they made fewer trips, but spent more time driving than people in more affluent communities. So again, this might have to do with having to make longer trips to perhaps access grocery stores or employment sites. On the next slide, we'll see that similarly during the initial stages of the pandemic, folks in high poverty neighborhoods made lengthier vehicle trips than before the pandemic and experienced a smaller reduction in the number of miles they had to travel than people living in more affluent areas. On the following slide, we'll see that when we look at neighborhoods with a high number of Black and Latinx populations, there was also a smaller reduction in the weekday vehicle trip volumes with slightly higher reductions in time spent driving than people living in areas with a low number of Black and Latinx populations. On the next slide, we'll see that during the initial stages of the pandemic, people in communities with lower Black and Latinx populations experienced a reduction in their weekday vehicle trip lengths, about 3 times greater than people in majority Black and Latinx neighborhoods, and a greater VMT reduction. Next slide, please. So the preliminary insights that LADOT pulled together do also include public transit, bike share, and qualitative data, although I don't touch on that here, but all of the data helped our department to respond to traveler needs during the current crisis. Specifically, we've increased communication about public transit, vehicle cleanliness, and adjusted signal timing to prevent speeding, reallocated underused roadways for outdoor dining and shared public spaces. And as I mentioned before, beyond our immediate response, these initial findings indicate that people of color are bearing the brunt of this public health crisis and of the larger systematic failures. So as one of the most diverse and populous cities in the world, Los Angeles hopes to inspire cities to plan for user-centric investments to provide universal basic mobility to all users of the transportation system. Next slide, please. And specifically in terms of our next steps on this project, we are committed to continuing advancing our understanding of mobility needs in the city to make sure that we're accelerating high benefit investments in infrastructure and mobility. LADOT is currently continuing this research to articulate how people in different parts of the city experience transportation differently, with a focus on racialized and equity-seeking groups. And in the coming months, we are currently and will continue to be partnering with experienced researchers. Our department's research team will be releasing an updated report on mobility during the COVID-19 pandemic with the aim of developing user personas, neighborhood base that can inform our policy and funding decisions. Next slide, please. And I just want to give a huge shout out to the amazing research team at LADOT with Karina Macias and Rose McCarran, who took on this effort and crunched the numbers late into the night over the weekends, and worked on creating this the work that you're seeing today during the early phases of the pandemic to help LADOT understand these trends and plan our response.